So we don't expect to see any issues obtaining Pfizer vaccine. We have a certain amount here still. I don't remember the number off the top of my head. But we also reached out at the end of last week to check on regional availability. You know, if we did have to reach out, and there is plenty regionally. In addition, we can always reach out through New York State to order some more. It used to come only in boxes of 1,170. Then they dropped it back down to 400. So you could get basically half. Now they've upped that back to 1170. So again, Pfizer is what requires the ultra low storage. So we have an agreement with a facility to hold that in ultra low storage for us. One thing that I think is important to note is we haven't had an issue obtaining Pfizer throughout this entire pandemic. The only issue has been, you know, just coordinating around that ultra low storage. And we've got a system in place for that now. So we feel pretty confident in our ability to continue to offer that to the community. So keep in mind that this, taking it from emergency use authorization to full approval, is only for 16 and up. So for the younger folks, that's still under emergency use authorization. So I did want to point that out. So really, you know, so I just wanted to kind of mention something because I get a lot of questions about the emergency use authorization from the FDA. It's a mechanism to facilitate the ability and use of medical countermeasures during public health emergencies. Under the emergency use authorization, FDA may allow the use of unapproved medical products or unapproved uses of approved medical products in an emergency. That's not to say that it hasn't been tested. The testing was done in advance of the release in December. They do some things in the testing phase at the same time of the production phase. So it's still tested. I hope that this does give some people peace of mind now, if they have been kind of on the fence, that this next stage of being approved would help them, if they are on the fence, to decide to obtain a vaccination. So a couple of weeks ago, we started to offer all 3 vaccines at our clinics: Moderna, Pfizer, and Johnson & Johnson, pending supply availability, because we're still having some problems with the J&J. I would have expected that with the approval of Pfizer for 12 to 15 and school upcoming, that we would have gotten some more attention at our school clinics that we had at the beginning of the month. That didn't happen. So I'm hopeful that, you know, as long as this gives people some peace of mind that they may need to get a vaccine, that they can come and get one. And we're trying to go out to all the regions of the county and hit the highest need places and be able to give the vaccine to people that they're looking for, the one that they want. So I think it's important for us, the health department, to know we're not pushing vaccines on those that don't want it. We're not trying to force vaccination. We're trying to provide it to those who want it free of charge. And we're trying to reach out to those places in the community that may not have the transportation that other people have, may not have accessibility to the internet. You know, we've switched to a lot of walk-in registration clinics and gotten away from the pre-registration. In addition, our site at Wisner Market all summer has done very well. We did a site at a school supply giveaway on Sullivan Street over the weekend, in which we vaccinated 14 people. So, you know, that's 14 people that weren't vaccinated beforehand. So again, we're still here. We're still going to be offering them. If you don't want to go through the health department, you can reach out to your medical provider and obtain it that way.